We know that when kids are going through chemotherapy, their immune systems are really compromised, and so they're at a higher risk for getting many of the colds, flus, viruses that go around, and if they get those illnesses, they can get a lot sicker than an average child would get.
It's important for kids who are on chemotherapy to resume their normal activities of their normal life. And we really recognize that that can be a difficult thing for families. A lot of families, their inclination and their intuition is to just hold those children safe and close and try to limit those opportunities for them as a way to keep them healthy.
But we need to let them explore and in a safe way. And so we can send them to school making sure everybody knows to wash their hands. We can have them play on the playground, do the monkey bars, get their arm and core strength, right? Build their bone strength during treatment.
We do think it's important for kids to get out, and we have 5 healthy tips to help keep your child healthy when you are out and about.
Really the most important thing to do that is good hand washing. So a lot of times keeping an extra, big bottle of hand sanitizer around in the classrooms or friends' home, using hand sanitizer frequently is really probably the best thing.
Other things kids can do is remember to cover their coughs, cough into their elbow, and that's a good thing that it's easy to teach, to ask the teachers in their child's classroom to make sure that kids are washing their hands and covering their coughs.
Another practice that we know can help decrease the spread of illness, particularly during viral seasons, is wiping down tables, particularly after snack or meal times, doorknobs, the surfaces that are commonly touched by a lot of children. This is particularly important for really young children, so we recommend with a disinfectant wipe, basically just frequently keeping those surfaces clean.
If you have a communal bowl of popcorn, you potentially having multiple hands going into that bowl, introducing multiple germs. I think as a teacher or parent or whoever is in charge of that, what you could do is have it prepared and then divvy up different portions on napkins and serve them individually so that there's not multiple hands going into the pot, so that you're minimizing any extra bacteria that could be introduced to that child. There's lots of fruits and veggies that are individually packaged that have been cut up and prepared and that are packaged and sealed that would work too. String cheese is another good example. Those would be things that would be healthy but still make good snacks.
Vaccines are vitally important. The best protection for the child going through cancer treatment from developing those illnesses is having the children around them vaccinated. So all of their siblings should receive all of their vaccines, and the same thing for their daycare mates, classmates at school, that sort of thing. Communication back and forth between the parents of the child going through cancer treatment and the school is really vitally important. It's also incredibly important that I think the whole community understand, so that child, schoolmates, the families, the parents of other kids in that child's classroom, for example, or the school, be aware that there's a child going through cancer treatment so that they can participate in trying to help protect that child from getting very ill.